Well, a warm welcome to today's talk, Monday the 27th of March. Running on rather limited technology today, but I wanted to bring an article I've been reading about Sweden. Of course, this is the issue about lockdowns. Were lockdowns effective or not? The answer seems to be basically that they weren't. So let's have a look at this. Now, this is data from Sweden. Now, the famous epidemiologist in Sweden, Dr. Anders Tegnell, he said lockdown was never on the agenda in Sweden. And he's the state epidemiologist who basically was in charge of pretty well everything. Now, bear in mind at the same time, the United Kingdom Scientific Pandemic Influenza Group on Behaviour, nice Orwellian title there, I would have thought, that said to increase adherence, a perceived threat, the perceived level of personal threat needs to be increased. So in the UK, it seemed to be almost, well, it was official policy to frighten people. And we know this from some of the leaked emails as well from the former Secretary of State for Health, Matt Hancock. And we'll look at the great difference between the Swedish approach and the UK, and indeed the US approach in most states, although in the States it varied quite a bit. So this official idea that we had to increase fear in the UK. Then we have Professor Neil Ferguson from Imperial College. He said, this is way back in March 2020, of course, letting the virus spread freely would result in 510,000 deaths. Now, it was this report that the government acted mostly on to institute the first lockdown. From memory, it was the 23rd of March 2020 for the first lockdown when Boris Johnson told us all to stay at home. And that report wasn't actually peer-reviewed at the time, so it's fairly tenuous evidence, but the politicians seem to have taken fright. But of course, this was with the agreement of the chief medical officer and scientific officer. So great contrast between the approach from the two countries. Now, here we see the cumulative death figures, and we'll see what kind of, I don't like to be glib about that and say results, but the United States had the highest level of death, then Italy, then the United Kingdom. This is per capita adjusted, of course, Spain. Then it was Sweden, Germany, Ireland, Finland, Netherlands, Norway. So Sweden, I think it has to be said they're not doing as well as some of the countries round about, but, and it's quite a big but really, and there's no way to sugarcoat this, Sweden got it wrong in the beginning. It was sending supplies of midazolam and opioids to nursing homes, and people died that shouldn't have died. They were put on end-of-life care pathways at an early stage. Now, whenever I say this, I get lots of critique from some nurses and doctors who say, don't you realise that midazolam and opiates are very good in end-of-life care? And of course they are, if used correctly, but like any drug, it's toxic in large doses, which is often what happened in Sweden. So they were off to a bit of a, what you might call a bad start from that perspective. But yeah, even so, more deaths than the surrounding countries, but less than the United Kingdom and the United States, quite considerably so. And if we actually look at the way that deaths panned out over time, so this is a comparison between the United States and Sweden, and basically we don't see a lot of difference. Now, I am very aware there's been more deaths in Sweden lately, but this is not to do with lockdown, and we'll be looking at reasons for that later. So very comparable waves, all familiar now. This was the original Wuhan wave, the Alpha wave, Delta and Omicron waves coming after that. And then if we do the same comparison, I think we've got here with this is a comparison with the United Kingdom and Sweden. And again, these high peaks here in the United Kingdom, deaths per capita, much, much higher than Sweden. As we know, because overall there was more deaths in the United Kingdom per capita than there was with Sweden. So certainly on a national level there, no evidence that the lockdowns were effective, but some more interesting information. Now, this is Anders Tegnell, the epidemiologist. If you put numbers into models, talking about the Neil Ferguson model, actually, the Imperial College model that got us all locked down, basically. If you put numbers into models and you don't know those numbers are fairly much correct, you can arrive at very strange results. So, yeah, I think we agree. I think we agree with Dr. Tegnell there. You need to weigh together different sources of science, and then you can maybe arrive at something that's reasonably, hopefully true. So he's talking about the integration of science rather than the simplified. Well, these models aren't simplified, they're remarkably complicated, but modeling's only one method. There's other ways to derive truth, such as looking at the virology, the epidemiology, and of course previous clinical experience, which Dr. Tegnell had. And you need to be really doubly check and see if you get more people doing the same thing before you can feel reasonably safe. But to rely very much on just one study, one model, that's quite dangerous. So there we go. In a very polite way, you're saying the UK approach was dangerous. And in retrospect, we can see what he was talking about quite clearly. The many disadvantages of lockdowns. I'm actually doing a bit of research on this at the moment, more to come on that. So, there is some disturbing things happened in the United Kingdom in 2020. But more to come on that in the next week or two, I hope. Research is a time-consuming business. Swedish people were advised to work from home, ban on gatherings of over 50 people, few rules for restaurants. Other COVID measures were entirely voluntary. Now, this guy, Johan Giesecke, was the previous state epidemiologist. And Dr. Tegnell seemed to go through the pandemic with this guy's reassuring hand on his shoulder, which is probably why one of the reasons he didn't bow into the pressure that he was under to institute lockdowns. He said apolitical, one of those people who did what they were supposed to without reflecting too much on what was expedient politically. So talking about Dr. Tegnell, this is the actual previous state epidemiologist who appointed him. And of course, in the UK, what did we have? We had either the Prime Minister or government ministers on every briefing. Agnes Tegnell. If you go back to the Spanish flu of 1918, you can find instances where they tried to lock things down. But in all of the pandemic plans we have been discussing during the last decades, closing down society has never ever been on the agenda. Well, what about shutting down short term was a question that was asked. I mean, this is Dr. Tegnell again. I mean, if you know what healthcare system basically is saying, if the healthcare system needs a few weeks to get ready, ramp up ITU capacity, that can be a good idea. So it can be a solution. But airborne respiratory virus was going to sweep through the population anyway. This was always completely inevitable because of the airborne nature of the virus. Now, interestingly, there was that famous WHO, World Health Organization meeting where Dr. Tedros said this virus is airborne. And Mike Ryan next to him passed him a note saying, you can't say it's airborne, well, presumably saying you can't say it's airborne. Because after that he said, I don't mean airborne as in paratroopers. It seemed the WHO knew it was airborne, but wasn't talked about. But it was obvious in Sweden that this was airborne, therefore was going to go everywhere. The best you could hope for was to slow it down for a while and protect the vulnerable. The cost of locking down would be horrifyingly high, he says. And of course, many of you watching paid the price of high lockdown economically, child development, and most tragically of all, in the healthcare situation where relatives were allowed to die on their own or with a relative on the phone. This was a horrendous price, perhaps shouldn't have been paid. Was the world influenced by China, he was asked. China, of course, is a state where draconian things like that can be done, Dr. Tegnell said. And it did work to a certain extent. In fact, it did. The Chinese actually got rid of the virus. That's why it would stop the flights early on. It would have been all right. The Chinese actually locked down for a long period of time. But viably, that's just not possible anywhere else. And not desirable, because the Chinese eventually had to open up. And now the Chinese have community level natural immunity, as we all do, because it's spread through China very rapidly. So for a while there was an idea that we should have very strict measures like a hammer coming down, bam, Dr. Tegnell says. Bring the hammer down hard and then take the hammer away and then sort of let it up, slowly build up again and then bam. Because this is exactly what we did. We had these on-off lockdowns that were completely, looking back, at that death data at least, ineffective. Did the early lockdown, the first lockdown in the UK, reduce the peak of infections so the hospitals weren't overwhelmed? There is an argument for that. So it's not all bad. That early lockdown was probably to a degree necessary. But all the later stuff that came after that is very, very, very equivocal. Dr. Tegnell said that didn't work. We learned quite soon that it's easy to start having different kinds of restrictions, but it's very difficult to stop having them. And even now, we've still got these post-COVID restrictions like difficulty seeing your GP, for which there's no rationale for whatsoever. It's just become sort of a habitual way of life, almost, tragically. So in Sweden, there was no billboards with scary pictures of COVID patients, no masks, no street, no furniture of fear. There were masks actually later on, I think, in the Omicron, but not in the early stages. And this is what the BBC were particularly good at. So what the BBC do is when there's a problem, they'll go to the person that's got the worst problem. So there was a pandemic. So what do the BBC do? They get special permission, they go into intensive care units and they film the sickest people. And then they always find someone who can just talk, but only just, who wasn't vaccinated and said, oh, I wish I'd had the vaccine now. Can I have the vaccine now? And you've got some doctor saying, no, it's too late. You can't have the vaccine now. They focus on particular cases rather than on the other 9 out of 10 who perhaps weren't in intensive care, or the 99 out of 100 or even more that weren't in intensive, well, many more than that weren't in intensive care units. So really a rather distorted view, really. I think that was part of the problem in the UK as well. That we apparently they didn't have it in Sweden. Mobile phones record shows Swedes chose to restrict travel and social activity, so they were like self-restricting. People told it was safest to be outdoors. We actually had the situation where people were being arrested for going outside walking in the countryside. How could you possibly be safer than outside? Where was the science in that? It became political and we didn't have the science. I think this was a big part of the problem. Swedish people were told it's safest outdoors. Swedish national parks were the busiest they'd ever been. Denmark and Norway closed all schools on the 11th and 12th of March. Sweden only closed schools for over 16s, and universities moved to remote learning. The younger children stayed in. They absolutely stayed in as normal. So the 13th of March, Johan Giesecke, this is the previous epidemiologist, remember, wrote to Andreas Tegnell, the current epidemiologist. And this is actually a Latin phrase, so Boris Johnson will probably like it. Don't you know, my son, with how little wisdom the world is governed? And that's what gave him the courage to carry on his path. Don't you know, my son, how little wisdom, with how little wisdom the world is governed? I can't give you the Latin, I'm not a Latin scholar, but yeah. Was there a period of mass insanity amongst the world governments? It'll be debated for a long period of time, of course. I'm not pretending to give a definitive answer in this talk, but it's an interesting debate. Very interesting debate indeed. And basically, it looks like Sweden got it right more than we did, I think, is apart from their aged care facilities in the early stages. Dr. Tegnell himself said the world has gone mad. In Sweden, it's even written into law that healthcare should be driven by evidence-based medicine, and that was so quickly left behind in other places. So it's an interesting question. Do we have mass insanity in the world at the moment? These COVID, irrational, scientific, non-scientific COVID measures were one example. Are there other examples you can think of where we appear to have mass psychosis or mass madness in the world at the moment? We were presented with these lockdowns as if there was no alternative. And because we didn't have the full data ourselves at the time, we took the word of the chief scientific officers and medical officers. This is the problem. The main problem, perhaps, for me personally, was naivety. I believe these people. The politicians said we're going to follow the science. The scientists said, well, here is the science. We didn't have full data to analyse it ourselves, and this is what we got. It's all worked out very well, of course. They've got knighthoods and things and damehoods. I'm not sure how it's worked out for the rest of us, though. So Sweden, that's a good idea. Stefan Löfven, Sweden's Prime Minister, played no part in the 2 p.m. meeting. So they had meetings just the same as we did. They had the afternoon meetings during the COVID pandemic. They had the Secretary of State for Health there in Sweden, but they didn't have the Prime Minister. So the party politics and the politics was largely kept out of it in Sweden, where Well, if you live in the United States, you don't need to tell me about the problems that arose as a result of politics, where beliefs were politically determined rather than scientifically determined. Now, the Daily Telegraph says this in their article. There was no baying for blood like there was from the British media as broadcasters with GCSE biology screamed at hapless UK ministers to hurry up and shut down the schools. We did comment about this at the time. At the time, I did check this, and there was no doctors reporting for the BBC. There was no nurses reporting for the BBC. Certainly amongst the senior staff. There was no pharmacists, there was no physiotherapists, there was no vets. And I don't think any of the senior reporters had a science degree. Quite a few of them came from economic backgrounds. They had BAs in journalism. And we had these people that weren't scientists filtering the news as they saw fit, but without even basic qualifications in science. I mean, a degree in science is just the entry into science. It's the most basic qualification. I don't think, correct me if I'm wrong, any BBC journalists watching, if you're graduates in science, but at the time I checked and I didn't see any. And the other mainstream broadcasters weren't any better. Now, I'll put this in as a quote from the Telegraph. It's not from me, so but I kind of liked it. As broadcasters with GCSE biology screamed at hapless minister open and shut down the schools as if they knew anything about it. So I thought that was kind of quite a nice quote. Now, we've seen that deaths in Sweden have actually been less than in the UK and the United States, despite the no lockdown measures. But recently, the deaths in Sweden have gone up just over the past few months. The winter of 2022 to 2023, there was actually higher numbers. So this is the deaths in Sweden here that we see actually a peak. So okay, we expect the peak there. We expect the peak from the Wuhan variant, the Alpha, the Delta. But there's a peak last winter, which there wasn't in other countries. At least there is some in Western Pacific countries like the Philippines. There's more cases now, but this is confirmed by the WHO data. So we see relatively low cases in Sweden. This is December 2022, but we do see more deaths in Sweden that aren't reflected in other countries. So what seems to be happening here is, first of all, I think the Swedish authorities are very good at reporting deaths. And we can just see this on these graphs we looked at earlier on, actually, as well. If we look at that, we can see, you can probably see there that Sweden, there was an increase there, quite a big increase in the past few months in deaths. There was in Finland as well, to an extent as well. But we noticed that this fairly large peak here that we have in Sweden is not reflected in the United States, although the previous curves were. Also it wasn't reflected in the data from the United Kingdom as well. So we see higher deaths this past winter, in the past few months, in Sweden than in the United Kingdom. So what seems to be happening here is that COVID deaths are being... people don't seem to be dying of COVID pneumonia anymore, but it's exacerbating other conditions. But that's also true for the United Kingdom. So quite why there's an increased deaths in Sweden this past winter is not entirely clear at the moment, unless it's related to classifications and the way that they're reported. I am going to look at that in some more detail because it could be quite significant. But what we can say, I think fairly definitively, is that the increase in deaths in Sweden over the past few months, the overall deaths are still much lower than the UK and the United States. But the increase over the past few months that's not there in the United States and the United Kingdom, well, that still needs to be explained. But we can say definitively it's not caused by lack of lockdowns, because none of us have been locked down now for quite some period of time. So whatever it is, it doesn't seem to be that, comparing Sweden with the UK and other countries where we're basically just back to normal living now. So quite why that is, we'll be looking at and hopefully get some more definitive information on that soon. So that was an interesting talk. There's more news coming. There's some interesting news on vaccines today, which I'm going to start looking at very shortly. But I prepared that over the day, so I thought it was an interesting discussion to look at. Did lockdowns work? Comparing Sweden with countries that locked down, the answer is no, or not very well, or might have been necessary in the very early stages, but the ongoing COVID restrictions weren't beneficial, or at least I can't think of any data that's supporting them. And the idea that we still have lockdown restrictions now is, in my view, really quite ludicrous, because the virus is now endemic and will be for some time to come. So a few reflections there on lockdowns not working, politicians dabbling in things, and being let down by our leaders in many Western countries. Disappointing at best. But thank you for watching.